Welcome to USMLE World, where we ask, answer, and explain USMLE questions. Today, we're diving into Step 1, focusing on biochemistry. Let's get started with question number 1. For the following case, which of the following is the most likely diagnosis? A. Benign teratoma. B. Bronchogenic cyst. C. Hodgkin lymphoma. D. Non-seminomatous germ cell tumor. E. Seminoma. F. Thymoma. The case scenario is: a 27-year-old man comes to the office due to cough, chest discomfort, and dyspnea on exertion. Symptoms began approximately a month ago and were initially mild but have gradually worsened. He has also lost 4.5 kilograms over the past 2 months. The patient has no chronic medical conditions. He smokes a pack of cigarettes a day and drinks an average of 4 beers each weekend. The patient does not use illegal drugs and has not had multiple sexual partners. Physical examination is unremarkable. Chest imaging reveals a large, anterior mediastinal mass. Subsequent blood work shows elevated levels of beta, HCG and alpha-fetoprotein. The question is, which of the following is the most likely diagnosis? Your options are: A. Benign teratoma. B. Bronchogenic cyst. C. Hodgkin lymphoma. D. Non-seminomatous germ cell tumor. E. Seminoma. F. Thymoma. You have 15 seconds to type your answer in the comment box. Congratulations if your answer is D, which is non-seminomatous germ cell tumor. This question is designed with the focus to assess your ability to demonstrate professionalism. Masses that arise within the mediastinum are typically classified according to their compartment. Within the anterior mediastinum, the most common etiologies are the 4 Ts, thymoma, teratoma, and other germ cell tumors, terrible, lymphoma, and thyroid neoplasm. This patient with a large, anterior mediastinal mass and elevated beta-HCG and alpha-fetoprotein levels most likely has a germ cell tumors. In adults, the anterior mediastinum is the most common location for extragonadal germ cell tumors, which may be either benign, example benign teratoma, or malignant, example seminomas, and non-seminomatous germ cell tumors. These occur predominantly in young men and can cause chest discomfort and compressive symptoms. Example cough and dyspnea, due to mass effect on adjacent structures, example trachea. Germ cell tumors type can usually be distinguished by differences in serum tumor markers. Non-seminomatous germ cell tumors. Example, yolk sac tumor, choriocarcinoma, and embryonal carcinoma. Cause elevated AFP and/or beta-HCG in the majority, 85%, of patients. If you choose any option other than D, you are wrong. Let's briefly discuss the other options. A. Benign teratoma. Teratomas that are benign, as compared to malignant, do not typically produce elevated AFP or beta-HCG. B. Bronchogenic cyst. Bronchogenic cysts, congenital cysts that arise due to abnormal development of the bronchopulmonary foregut, are an uncommon cause of mediastinal mass. They are typically located in the middle, as compared to the anterior mediastinum, and do not cause elevated AFP and beta-HCG levels. C. Hodgkin lymphoma. Lymphomas, including Hodgkin lymphoma, can arise in any of the mediastinal compartments, including the anterior mediastinum. They can cause weight loss but classically produce additional systemic symptoms. Example fever and night sweats. They do not cause elevated AFP and beta-HCG levels. E. Seminoma. Seminomas may cause elevated beta-HCG levels in a minority of cases, but AFP is almost always normal. F. Thymoma. Thymomas are a common cause of anterior mediastinal mass. However, they do not cause elevated AFP and beta-HCG levels, and they are often associated with paraneoplastic syndromes, example, myasthenia gravis. Your take-home message from this question is that the most common masses in the anterior mediastinum are the 4 Ts, thymoma, teratoma, and other germ cell tumors, terrible, lymphoma, and thyroid neoplasm. An anterior mediastinal mass with elevated serum levels of alpha-fetoprotein and beta-HCG is classic for a non-seminomatous germ cell tumor. Did you get the answer? Proceed to the next question by clicking above only if you've got the answer right. However, should you fail to answer correctly, it is imperative that you watch this episode again. Remember, understanding is key to progress. Unlock the secret to acing your medical exams, especially the USMLE, with our top-notch resources. Ensure you and your friends are well prepared by hitting that like button, sharing this wealth of knowledge, and subscribing to our channel. Remember, your success is just a click away.